Well, good evening. Thank you so much for coming tonight. We're really thrilled to have Kevin Ashford here with us to talk about anxiety. He's the director of the Northwest Anxiety Institute in Portland. And this is part of our wellness series. So we're really listening to what folks are asking for in this community. We're trying to find ways to support our kids in the best ways possible. So Kevin has graciously agreed to come here tonight. He's been featured in different articles and has a YouTube video and is training all over the place. So we're thrilled that he was able to come here tonight. Some of the housekeeping things, the bathrooms are down this way. If you're a teacher and you'd like to sign in, there are sign-ups in the back, so make sure that you do that. Please feel comfortable to get up and move around, take care of yourself. So Kevin is going to talk for about 60 minutes, and then there'll be about 30 minutes where you're able to ask him questions. So please help me welcome Kevin.
Thank you. If you're getting up and moving around, I have a tip cup up here too, so feel free to swing by the front. No, it's a pleasure to be here. I've been doing a lot of these presentations to parents, teachers, school counselors, and just people that struggle with anxiety, which is many of us and many of your children. So, as Jennifer said, today we're going to talk for about an hour about lots of information and then give you plenty of time to ask questions. The truth is, if I stopped speaking now, you would probably have enough questions to fill an hour and a half, but we'll get into all that. So, a little story. When I was 11 years old, I locked myself in a bathroom on purpose. This was problematic for a couple of reasons. One is because it was the only bathroom my family had. And two is because I didn't want to go to school. And as I reflect on that as an adult and now as somebody that treats anxiety, I still can't really pinpoint exactly what I was afraid of, but I knew I felt really, really scared. And most of the parents that I work with really, really want to understand the why. What got me out of the bathroom was not a patient parent, was not necessarily a kind parent, it was a desperate parent. We were new, we actually immigrated to the country shortly before that. And we were living, my parents got a kind of a working class job, and my mom just said, if the school keeps calling and sending you home and you don't go to school today, I'm going to lose my job. And so it's not my recommendation that you use guilt and fear to have your kids behave differently, but it does speak to the privilege of accommodations when it comes to anxiety and how that maintains anxiety over time. If you have children that have anxiety, then you are likely participating in the maintenance of that, if you care for your kids. If you don't, you probably wouldn't be here. So the fact that you're here means that you care a lot, which means you're probably participating in the maintenance of that. Because you do a lot of things out of love, to nurture, to care for them when they're distressed on the Thursday night or the Monday morning or whatever it is, and you likely help. We'll get into that today as we go through these things. So one of the most important things I think to mention is what is the difference between anxiety disorders and angst and teenage anxiety. People ask me all the time, is this appropriate? Is this okay? Is this a problem? And so we'll talk about that today by speaking specifically about each anxiety disorder so you understand them, and then what teenage stress is, or just angst in ourselves, how those are different, and how they actually should be treated quite differently. And not just treated from a clinical sense, but treated from interactions with adults and parents and teachers and those kind of things. So anxiety disorders conservatively make up 25% of children. So that's a huge amount. And so when you add mood disorders in there and you look at things like depression, you're looking at 40, 50%. If you've got 2 kids, that's one of them, right? And that's before we really even start talking about genetics and all the things you've done to screw them up throughout their life, all the terrible decisions you've made. And then And that's just 40% of them. So they're struggling. And some of them are great. They're articulate. They can tell you they need help. Some of them are not. They're pounding their fists and crying and doing drugs and cutting themselves and doing things like that. And then some others, sometimes the scarier ones, are just not saying anything. And they're just white-knuckling it through class, and they're white-knuckling it through sports, and they're white-knuckling it through life. And we don't know. So I think just based on just the prevalence, we know that this is real for many, many kids. But I want to talk about specifically what they are. This is very important to me as a clinician. All my practice does is treat anxiety disorders, Northwest Anxiety Institute. Most of the people we see have been in therapy before unsuccessfully. And by the time I get those kids, and many of you are experienced, and therapists have different opinions whether we talk about diagnoses with kids or not, but here's my take on it, which is the right take. Diagnoses are important because it guides treatment, right? We believe in evidence-based treatment. We believe in treatment that has been founded in some kind of scientific evidence. And so how do I know what I'm treating if I don't understand the name of the thing that I'm treating? A diagnosis is just a name. It's just a cluster of symptoms that we label so we have an idea of what it is. So I'll caveat with that before we go into each one. But most of the people I see sit with their parents when they come in for the intake, and they say, well, we've been in therapy for a couple of years. And I'll say, oh, wow, okay. What was your diagnosis? And they'll say, anxiety and depression. And I'll say, that's not I don't really say this to them. That's not a diagnosis. Those are experiences that I had yesterday, probably both of them, right? And so it doesn't mean that they're pathological, but it does nothing to help me understand how to treat them. And so it's really important, I think, if your kids are in therapy, to understand what is guiding that treatment. What's the best way to understand how they're being treated? And for me, that's the way that I do therapy starts with a diagnosis. I also believe that in order to overcome anxiety, you have to be stronger than it. And to be stronger than it, you have to understand it really, really well. And when you understand it really, really well, I work with 11-year-olds that understand it. They'll say, I have social anxiety. This is why. Because when they no longer meet that criteria, they no longer have social anxiety. It's not a characterological trait. They don't have it forever. When they just don't meet those 5 symptoms or 6 symptoms, they don't have it anymore. So they work towards not having it. So social anxiety is exactly that. It is an experience of dread, fear of criticism and judgment. This is more so than most of us just don't want to be judged or criticized, of course. It doesn't feel very nice. But this is pathological. And what I mean by that is it's impairing. They don't want to go to school in case they don't look right. They don't want to eat out in case they don't do that correctly. What if someone judges them? They don't want to order their own food. They can't run into Fred Meyer and buy some milk if you just hand them some cash. They can't do any of those things. They don't do sleepovers, depending on their age. And again, we're talking here developmentally appropriate, right? So if your 4-year-old's not running in and getting milk yet, that's okay. I mean, mine does, but no big deal. So these are kids that are struggling. They're really having a hard time doing anything socially except this, right? And that's really, really protective. How many of you prefer to text instead of call someone to avoid conflict? Most of us, right? It's easier, right? How many of us just love to look at Facebook so we can judge people? It's easier, right? We really enjoy it, but we're not going to do that publicly. But we can get into screens and social media and stuff like that later, but these are the kids that just become isolative and quiet and don't engage. There's 2 types. That's more of the general type. And then there's just public performance anxiety. Kids that struggle to play sports in front of people. They love practice, but they don't like to play a game. The expectations are too high. They don't want to fail. And then other kids that can't get up here and speak. And not just in a setting like this, but they can't read aloud in class, or they're petrified that the teacher is going to say, so... And it's so scary that they'll avoid school that day, and they'll come up with lots of reasons. Maybe their tummy hurts. So OCD is a very unique and obscure diagnosis. I'm passionate about this. This is not being neat. This is not being quirky. You're not just so OCD because you had to straighten your chair when you sat down. This is so distressing for people. It is paralyzing fear. This is the most unique experience that you can ever describe to anybody. So an obsession is just an unwanted thought, something you don't want. That unwanted thought causes anxiety and distress. My compulsion is anything I do to manage that distress. The thing about OCD is it's not just hand washing. I could right now be doing lots of compulsions. I could be trying to say a prayer, count in my head, or do something to mitigate something awful happening that I know is irrational, that I know is possibly unlikely, but what if it's not? And this is really, really hard for many mental health practitioners to spot and understand because it's really, really bizarre. And it's relatively simple to treat, but it just has to be recognized and identified. People with OCD typically go 7 years before they get a proper diagnosis or treated. So it's a tough one. There's a difference between being obsessive about something and having OCD as well. So some kids are obsessive about stuff, which is maybe a really nice interest, right? So some people become obsessive about hobbies, obsessive about unique things that they like, obsessive about exercise. It doesn't mean they have OCD, it just means they're really into something, if it's not impairing. Panic disorder. This is something you just don't wish on your worst enemy. This is intense physiological fear, physiological discomfort, out of the blue, uncued, coming from nowhere. It has to be out of the blue, and you have to worry about having future attacks. This feels like you're dying. This feels like you're losing your mind or you're going crazy. And your kids can't understand it. We can't understand it. And if this happens in class, they associate fear, panic, danger, death with class. If this happens in the cafeteria, that's what they associate. If this happens at Walmart, that's where they associate it. And then you get to shop at Target. We make associations based on the things that cause a lot of fear. That's how our brain works. It's protective, but it's not very helpful when there's actually no danger. This is different if you have a panic attack in response to your fear of public speaking, right? That is still a panic attack, but we know exactly why. You were slated to get up there and talk, and you had a panic attack prior to. But language is really important because we've got to a place where we say, I'm a little OCD about this, and I panic because my mom didn't bring me a latte after school. So it's understanding really the impact that these diagnoses have on people. Generalized anxiety disorder, although it's interesting, it's got such a low prevalence rate because a lot of people struggle with this anecdote, like in my practice. This is the kid that's perfectionistic often. These are the kids that worry excessively. This isn't just general anxiety, this is excessive worry all the time with catastrophic results. So this looks like, what if I don't do well on my English test? If I don't do well on my English test, I'm not going to get an A in the class. If I don't get an A in the class, I'm not going to pass the class. If I don't pass the class, I'm not going to graduate high school. If I don't graduate high school, I'm not going to go to the college I want to go to. Nobody will love me. I'll be unsuccessful and my life is over. And they think that 1,000 times a day. It's absolutely exhausting. It's excruciating. And they think it about typical things. So OCD, we think of pretty irrational stuff. With generalized anxiety, we think of bills, grades, relationships, family, things that most of us worry about. This is just to a really extreme extent. It's demoralizing. So these kids often look very depressed because if you're worrying every single day, then you feel anxious often. And that level of anxiety leads to this experience of demoralization when it looks just like depression. And the problem is that then sometimes a lot of work is made to try and help them overcome the depression, and they just keep worrying. So that's when we really have to target the worry, because once the worrying stops, hopelessness or hope goes up and the depression goes down. So that's why I think diagnosis is important, because you can really understand, or you attempt to understand, the specifics. PTSD, this is an experience that individuals have following a trauma, a perceived threat, trauma to their life, danger, something awful happening. There has to be some time between the trauma, so there's a lot of awful things that happen in our lives that we're supposed to respond to pretty badly. Some things are really, really sad. Death of a loved one, car accident, some things are really, really scary. One has PTSD if your symptoms from there persist longer than kind of what's expected. And so it just depends. That's another term we use a lot. Like, I have so much PTSD from driving in traffic today to get here. Illness anxiety, it's interesting from my point of view. It's obscure. It's basically a excessive focus on getting sick. It's what we used to call hypochondriasis or hypochondriacs. And so, Mom, my head hurts. Do I have a tumor? My back hurts. Is there something wrong with my spine? My eyes are itchy. I think something really bad is happening. Can I get tested? Can I get looked at? I'm sick all the time. I'm worrying that it's worse than it is. And then specific phobias, these are awesome to treat just because they're really fun for me. It's awful for the people in therapy, but these are things like bridges, trains, planes, heights, those kind of things. These are the thing about specific phobias is people don't really get treated for them because we avoid them pretty well most of our life, right? So if you have a fear of flying, you just don't, or you do with a Xanax and a vodka tonic, and you do that once a year, and you're kind of like, that's okay, for the vacation. And then until you get promoted and now you have to fly frequently, that's when the people go to therapy because they're like, I'm showing up like a zombie because of my 6 vodka tonics. And they were only going to Seattle. So anxiety has a lot of very commonalities. It doesn't matter if you're 3, 13, 33, or 85. Anxiety loads on the intolerance of uncertainty. It's all about not knowing what's going to happen. We do not use the terms associated with anxiety to describe experiences of danger. If there was an explosion in the back of the room and we all ran that way, I would ask you guys what's going on, and you'd describe your bodies and you'd say, my mouth is dry, my heart is pounding, I'm tired, I feel a little dizzy. And I'd say, are you panicking? And you'd say, no, I just ran from the explosion. Right? We don't get T-boned in a car in a intersection and say I was flooded with intrusive thoughts, right? Because it's actual danger. But think of the perception of threat that happens in anxiety. The perception that something bad will happen and not knowing if it's actually going to happen or not. Most people, even most anxious people, respond to actual danger pretty well when they have to. Obviously, when I work with clients for a long period of time, bad things happen in their lives, and they're always shocked by their ability to tolerate the actual bad thing that happened, even sometimes for them, if it's been the worst thing they've worried about their whole life. So that intolerance of uncertainty is really, really important to help people overcome that in order to get them better. So that's what we look for. And then intolerance of distress makes sense. I really believe this question will come up inevitably. Why are more kids anxious today than they have ever been? There's lots of answers to that, and there's lots of kind of ways to look at it. But one of them is we are not very good at experiencing distress, and we're not very good. Oh, Siri. We're not very good at experiencing distress, and we don't like to feel uncomfortable. And when our children are uncomfortable, we feel that's a representation of us. And the best way to help us feel better is to fix our kids' problems so we don't have to tolerate feeling bad. And we pass that down, and that's kind of the soup we live in. We don't like to feel bad. And we don't use that kind of phenomena or theory when we work with our kids on other things. When your kid says, hey, studying is really, really challenging, we're like, yeah, keep at it. Practice is really, really hard today. Coach is all over me. Yeah, work harder. Because if you work hard, we know that you build tolerance to stuff, like physicality. Not something I've ever really figured out, frankly, the physical part, but that's how it works. So when it comes to anxiety, we're not really good at letting people feel bad. And so when you've got two things, intolerance of distress and intolerance of uncertainty, it's really kind of the makings of an anxiety disorder. Anxiety is the experience, it's a future concern. So it's a what if. That's where anxiety lives in the future. What if something bad happens? Depression is an experience of the past. Shoulda, coulda, woulda. Right? When we engage in these thoughts of anxiety, what if, and depression, we can't be in the moment. And being in the moment, we have to experience that even if we feel really uncomfortable, nothing bad is actually happening. Because again, if something bad is actually happening, it's danger. And so helping people live in the moment is really, really challenging. So what I ask kids to do that have pets is to behave like their dog. I don't know if cats live in the moment. Cats creep me out, but dogs I know for sure, right? Dogs live in the moment. So If I left for work today and I didn't feed my dog, he's hungry. He's bummed. He's upset. He's hungry all day. I get home and I feed him, and he's full. He's living in the moment. He now doesn't sit there after he has eaten his dinner and go, shit, what if he forgets to do that tomorrow? Right? That's what we do. We have a bad experience, so we project that onto the future. He also doesn't sit there after I feed him and go, I can't believe you did that today, man. Right? That's terrible. And many of you, if you're anxious, have anxious animals because you treat them sometimes like they're always living in the future or living in the past. So staying in the present is really, really challenging. It requires so much more than just asking people to stay in the present. Mindfulness has come around in the last couple of decades, and it's very popular and it's very sexy. And it's really an opportunity to teach people to try and pull back to that moment. Mindfulness and exposure therapy are very, very similar. In fact, I may argue sometimes that they're the same. They're just worded differently because it's about sitting with feeling bad and not doing anything about it. And what we find when we do that is nothing bad actually happens. If you've ever felt anxious before, and you've worried about feeling anxious again, I ask you, how many times have you died? Despite, someone raised their hand? No. Despite it feeling really, really bad, nothing bad actually happens. People don't die from panicking, despite how terrifying it is. And it really is terrifying. In fact, I don't want to minimize that. I want to make that so clear. Because empathy is so important in understanding if your 13-year-old is petrified to go to school, like I was at 11, and I didn't understand why, and your 13-year-old might not. And what we keep saying to them is, how come? You've got friends. Look at your hairline. Right? People like you. You're athletic. You're doing great in class. And they, no, I'm not. Oh, those grades aren't in yet. I know, but we know you are. Right? And we're trying to help understand. I saw 9 patients today before I came here, and my last one, awesome girl, she was super frustrated. I've treated her for OCD, but she just said, you know what my mom keeps saying to me? This just happened at 5 o'clock. Or at 4 o'clock. I said, what's that? She's like, my mom keeps saying, it's a choice to be overwhelmed. And I'm like, and she's like, I know what she means. I know what she thinks she means, but what she's telling this kiddo is snap out of it. Don't be upset. Just change your emotions. That would be awesome. And my field wouldn't exist if we could do that, right? But I understand the sentiment. We just want people to feel better, and we can't just will them to. I mentioned this before, perception of threat versus actual danger. And what are some of the symptoms in kids? So they don't always look like anxiety, right? This is kind of hard to read, but the physical symptoms in children look like stomach aches, muscle tension, headaches, difficulty swallowing, fear of vomit, a lot of down this kind of center line, difficulty wetting the bed or not, bladder urgency, bowel urgency. And so many times your kids are going to the nurse's office, or they're just asking to stay home because they don't feel well, and parents feel really, really stuck. How do I know if it's because they're nervous? How do I know it's because they're sick? I'm not sure. And so figuring that out is challenging because, again, you want to validate your kid, you want to empathize with them, but you also don't want to accommodate their anxiety. And we'll talk now a little bit more about what that means. So, the way I help kids overcome anxiety is identifying it as a bully. Anxiety is an experience that when we make decisions based on it, it's kind of beating us, right? It's controlling us. It owns us. Now, I am a little brother, and so I have perfected teasing for a long time, 34 years, in fact, for my poor older sister. And she's never really figured out how to have me not tease her. Maybe she'll go to one of these talks and figure it out. But it's been so fun to tease her because I'm her little brother, right? But this is how anxiety works. Anxiety drops a thought on a kid or on one of us. And most of us have been trained to cope with anxiety. parents are often saying to me, it would be really helpful if you could teach my kids some coping skills. None of you have probably ever said this, but they just need tools in their toolbox, right? My kids just need tools in their toolbox, and that's why they brought them to me, like I'm Home Depot, right? I don't know what that means. I know what it means. I know what they're asking. But if every time an anxious thought comes or an anxious feeling comes and your kid does something about it, that's like a bully poking them and them complaining and, I don't like it. Why did you do that? Right? We know that if you're trying to tease someone, that's exactly what you're going for. That's the exact experience that you want to happen. So my sister is quite pretty. She's lovely. And my aunt is not. And so for years, I've been teasing my sister about when I see her, I'll say, because I know, hey, you look good. Nice to see you. You look just like Aunt Kath, right? And she goes, oh, why do you say that, Mom? Mom, we're 35. Why does he keep doing this, right? And I'm like, right? And my wife's rolling her eyes and everybody's like, can you grow up a little bit? This is how anxiety works. So it doesn't matter if I'm running from my fear or I'm laying it with coping skills. I'm responding to the bully. And so the bully gets bigger. What my poor sister hasn't figured out is that when I show up, and this is what really we do in exposure therapy very systematically, is that when I show up and I say, you look just like Aunt Kath, she says, okay. And I go, no, like you look like your shoes, your hair. She's like, okay. Now I'm an idiot, and I'm embarrassed. And I'm very less likely to say that again. That's kind of the neutral way. What we do is a little bit more provocative, is we teach kids to run at their fear. So the equivalent of that is my sister, when I open the door, running up to me and going, don't I look just like her? Who? Aunt Kath, don't I look just... Now I've got nothing. I'm never using that joke again, right? So when we help kids change their fear of, I hope I'm not going to be embarrassed today at school. Mom bought me all these new clothes. I got, everything's good. I've got money. I feel good. I got the new iPhone. Everything's good. Oh man, judgment. I'm out of here, right? Versus going in and going, this is just this is a mental experience that builds confidence. Bring it on. I make people stand up and do this. Come on, anxiety, bring it. It's nowhere to be found. But that's really hard to do, and so it takes a process to get people there, especially when we've been spending most of our lives avoiding that experience ever again. But it's impossible to know how to get over anxiety by running from it. And a coping skill is that, in my opinion. It helps temporarily, and it has its place. But to overcome or change your relationship with it is a different beast. So how is this different than just stress, right? Because these are your kids. They've got so much stuff going on. They've got shame, they've got guilt, they've got expectations, they've got all these things. And they're stressed out. So in their life, they've got the experience of school, friends, family. And we're just loading up this bucket, right? When your bucket's full, you can't tolerate stress. But most kids have to experience these things. Life is stressful. And so, if you don't have any tolerance for that stress, you need lots of accommodations and help to help you manage. And so parents are feeling like they're chasing their kids around to do lots of things for them to help them tolerate this distress. If you care about anything, you're going to be nervous about something. It's adaptive. It's helpful. Too much of it's problematic. Not enough of it is problematic. But you can't do two things. Well, you can, but it's not very fair. You can't say, it's really important for your college application that you participate in 4 years of an extracurricular activity. It's also really important that you have excellent, and by that I mean straight A's. And I want you to take those IB classes, because that matters. And part-time job looks good, don't forget to volunteer. And don't come to me with that anxiety stuff, right? Don't be overwhelmed by any of that, right? So I see kids sometimes that are really high functioning, way smarter than I will be ever. They're 18, and they're super anxious, and they're studying 6 hours a night, and they want to go to the top 5% of schools in the country. And they're struggling with stress and anxiety. And I asked them pretty quickly, are you willing to give up any of the things that you're doing right now? You're taking the hardest classes at a very challenging school. You're applying to very difficult colleges. You have an immense workload. You play an instrument. You're captain of the football team. You've cured cancer at 16. Are you willing to give any of that up? And they say no. And I'm like, I think I'm a pretty good therapist, but that's overwhelming for most people. So we have to have realistic expectations of our lives. We have to have realistic expectations of our kids. And some kids can tolerate this really, really well. Some kids just can't. Some people just can't. Think of in our own lives, friends that you have that have struggled in and out of jobs. They can't keep them. They're always overwhelmed. They struggle with relationships. There's lots of reasons that that happens. It's not all bad luck. And then there's other people that work 60 hours a week and they don't feel stressed at all. So we have to kind of gauge what that actually means, because stress is a healthy experience that should be there if you care about something. And the goal is never just to get rid of it. It's protective, it's adaptive. Stress is the thing that helps you prepare for the exam. Caring about doing well is great. Having an expectation of getting a perfect score is awesome. It's not awesome if you can't study and you procrastinate because you're so scared of failing that you can't ever get there. But the preparation required requires some distress. If you want to go on a date, you should be a little nervous about it, so you shower and brush your teeth and show up on time. Right? With zero distress, that doesn't exist. So what is cognitive behavioral therapy? This is really important because this is another term that is kind of thrown around quite a bit. CBT is the experience. CBT is a theoretical modality, meaning it's a way that we do therapy, and it stands for your brain, the cognitive part, your behavior, and your feelings. So you can't really see this here. This is a hammer just to indicate like behavior. When most people go to therapy, when parents bring most kids to therapy, they want this to change. They want their feelings to change. I want to feel less anxious. I want to feel less depressed. I want to feel more confident. But we can't, I mentioned this before, we can't change that directly. It's impossible. We cannot change our feelings directly. Again, if you could, my profession wouldn't exist. We'd have bad days and we'd just go, cool, I feel better. But most of us use our feelings to guide how we make decisions. I'll study when I feel like it. Okay? I will practice piano when I feel like it. If we all went to work when we felt like it, we'd have a really hard time getting there, right? Most of us go to work out of obligation, out of a schedule, out of fear of consequence or the reward of getting paid. But we don't go because we feel like it. I'll work out when I feel like it. Doesn't happen. But we use this, and kids use this, and they lay in their beds, and they're like, Mom, I'll get up when I feel like it. I just don't feel like it. And you're like, oh my gosh, what do? I feel so bad because he's so miserable. But I can't help him right now because he's so miserable. And so when clients come in for therapy, we just say, let's stop focusing on this. We're not even going to talk about your feelings. We have some control over our thoughts, but we don't have 100% control. So if I ask you to think of this mic, you can. So whatever you are thinking about, daydreaming about, maybe even paying attention, you can think of the mic, which is awesome. You can allocate those cognitive resources to think of the mic. I can even hide it, and you could still think of the mic. So you can control your thoughts. But now if I ask you not to think of the mic, whatever you do, don't think of the mic. It's really, really challenging. As much as you try not to think of the mic, that's all you think about. Now imagine it's not a mic. Imagine it's a self-deprecating thought that you're fat, that you're stupid, that you're ugly, that you're a failure. And you try just to push it away. And you can't, and it looks like this. Kevin, you're an idiot. I don't want to think about that. Nope, I'll just look over here. Look, distraction. Netflix, 12 hours here. Cell phone all day long. And it sits here. And if your children struggle with anxiety or depression, they probably have a hard time sleeping. Because what happens when all that stuff gets shut off, all those distractions are gone, even if that's friends, even if that's weed, even if that's whatever that is, that awful thought is still sitting there. So you might distract it with really nice things. You're having a rough day, let's go shopping. Let's do this, let's distract you. We'll take you to the movies, right? We'll invite your friends over. We'll get your favorite meal. We'll go to dinner. Right? Parents love doing all sorts of things to try and shake kids out of their awful moods, right? And the tricky part about that is we can still be really depressed and really like that we're getting something. And that's really confusing for parents, right? Because they're like, my kid is so depressed. You want to go to the Apple store? Yeah, all right. Right? And then we're like, what the heck? Because it's still just distracting them. It's holding them off for some time until we have to go back to those awful thoughts. Now again, if this is just a stress-related thought, not an anxiety, pathological thought that comes up all the time, distraction is not terribly bad. So if this is the only public speaking gig I got or ever have again, and I knew it, I said, I'm only doing one, I don't like doing it. So driving here today, I just blared my music, rolled down my window because I was scared. And it's totally distraction until I get here and I get through it. Great. I don't have to think about it again, I probably won't. But that's not a very healthy way for me managing this if I'm going to do these frequently, because I can't do that every single time. So we can't control our thoughts 100%. So I don't ask people to. Most people think therapy is just about talking about stuff. And let me ask you, the last time you kind of talked your way through being anxious, you probably ended up way more anxious. So it's not very effective. So behavior is where the money's at. You can control all of your behavior. All of your voluntary behavior. I have to preface that because kids always go, I can't control my breathing or my blinking. Told you they're smarter than me. You control all your behavior. You can stand, you can sit, you can move, you can talk, but you make a lot of decisions what you do with your behavior based on your feelings and your thoughts. So people will all say, I can't. And I don't say that from like a motivational, like, yes, you can. People say I can't, and what they mean is I don't feel like it. And I asked them to rephrase that. What do you mean you can't? Do you mean you don't feel like it? Do you mean you have scary thoughts associated with it? What are the thoughts associated with it? Well, if I do that, something bad will happen. Okay, well that makes sense why you're not doing that thing. But because these are all have a bidirectional relationship, meaning you influence one, you mess with the other, we know that if I ask kids to change their behavior without thinking too much, and to just tolerate feeling bad, that they actually get better. So my motto, I don't know if I think I stole this quote. I can't remember where I got it, so I'm just taking it. But I have it on my website, and it's, you're already miserable, you may as well be miserable on purpose, right? Because what I'm asking people to do is, people come into therapy and they're like, I'm super anxious. And I'll say, kids. I work with kids with separation anxiety, and I'll say, okay, cool, well, let's leave the office. Let's go for a walk. And my office is in Portland on 11th and Cooch. It's pretty ghetto in the neighborhood. So it terrifies a lot of the kids that come. I'm scared. That's why I bring the kid with me when we walk around. Somebody to trip and run. And they're like, but that makes me nervous. I'm like, that's exactly why we're doing it. But you spend 20 minutes with me walking around and out coming back without your mom there or your cell phone at 11, your anxiety will reduce. And now your brain has a new experience of, oh, that crazy awful feeling that I always get has gone away. New experience. I don't need my mother or my father to feel safe. So then shortly after that, I do things like I walk behind them and they're not allowed to turn around, so they have to tolerate uncertainty, right? I will never lie or trick a client, but I'll say, I'll just walk behind you, I promise I'll stay behind you, but you're not allowed to turn around to check. So if you ever walked up your stairs in your house and you're like, oh my God, there's a weird feeling, I just want to turn around, right? It's kind of like that for these kids because they need that certainty, and you do that enough, and then their goal is to walk around the block by themselves. And the biggest challenge for this example is convincing the parents it's okay. Convincing the parents that it's okay. And I do it with confidence, of course, because parents, this is what the mom is like when I'm sending this kid out the door. Okay, baby, I'll see you in a minute. Okay, right? And I'm like, whoa, right? The kid feels like it's the last time they're ever going to see their parent again. So behavior is so important in making change. And so think about that in your lives with any behavior change you've done. If you've ever changed a habit, you've had a home project that you want to get started for the last 12 years, right? Sometimes just going and getting the stuff at Home Depot kickstarts that stuff, because we've got all this fear about doing things, and we have all these ideas that we're not going to be successful at stuff, so we put it off. Or working out. Working out is something I've tackled for so long. I start and I stop and I start and I stop, and then I don't feel like it. And if I go consistently, if I wake up and I set my stuff up the night before, and if I just wake up and go 20 minutes into the workout, I start to feel good about myself. And then my thoughts are, good for you, which increases the likelihood that I might do it again. For me, it actually, when I wake up the next day, I'm just as miserable and I have to do the whole thing again, right? But eventually, I hope, a habit will form and a new behavior will be there. But if I only base it on feelings and thoughts, it just wouldn't happen. As humans, we're hedonists, which means we do not like to feel bad. We do everything we can not to. Anxiety causes an experience of yuck. Don't like it, distress, nastiness, icky, whatever you want to call it. Your brain wants you to do something about that yuck. The best way to cope with anxiety is avoidance. It's really, really effective. Super effective in the short term. Hey, Kevin, you want to come speak at Camas High School? No, thanks. Don't feel nervous about it anymore, right? It's that easy. The second I read that email and I get that public speaking, I just say no and I don't have to do it. Avoidance, right? Hey, you want to hang out at Sarah's house next week? No, thanks. Anxious, gone, right? That kid that avoids everything doesn't say, Mom and Dad, I'm a avoider. I don't know what it is. They say, I don't care. I don't want to, right? You want to go over to Sarah's? I don't care about them, right? You want to go out to eat? Not with you guys, right? And that's because sometimes they're nervous doing lots of things that we don't know yet. It could be they're nervous being in the car, they're nervous of vomit, they're nervous of ordering food, they're nervous of conflict because their dad always has all these weird requests when they eat out and they feel really embarrassed about that and they feel the social pressure, right? Or their parents honk at other drivers and yell at them. Right? We haven't even got to talking about shame and guilt yet. But that did remind me of one example. Parents always, one of the most common things parents say is, I want to be able to talk to my kids. And I promise you, I'm not just saying this. Teenagers say to me, I just want to be able to talk to my parents. I just want them to understand. And some kids are so scared that their parents will judge and criticize them. And I've met their parents. They seem lovely. And this one kid told me, if you've ever been in the car with my mom, she really says some mean things about the other drivers. And she doesn't even know them. So you imagine how critical she could be of me? And this broke this mom's heart when I told her this. I totally shamed her. Just judged her about the whole thing. It broke her heart because, of course, in her eyes and in her perspective, she has done everything to support her kid. She's got her in therapy, her kid's done all, a lovely, lovely family. But we forget all these interactions, that the way that we develop our personality and our expectations of the world, and ultimately our fear that if you have two parents, the two most important people in your life are you're not going to make happy. That is a huge, huge fear for most kids. That was a side note. So if we feel yuck, we've got to do something about it. That's just who we are as humans. So avoidance, reassurance. Mom, am I going to be okay? Mom, did you put that away? Do you know who's going to be there? Who's going to be there again? What time is that at? Wait, are you picking me up? What car are you driving today? Wait, are you coming? Are you nearly there? Right? Reassurance seeking. Every time I feel anxious, I've got to ask for more reassurance. And when you provide me with that reassurance, I'm required to get more reassurance because that feeling shifts pretty quickly. So if I ask you, do you like the way that I look? I'll send around a form. You can check a box or not. But and someone says, yeah, you look fine. And I say, okay, thanks. What about the shirt? Do you like the shirt? Yeah, I like the shirt. Looks nice. Yeah. You haven't seen my socks yet. Let me show you my socks, right? It is no longer about assurance. Do I look nice? Yes, you look lovely. Thank you. But now I'm seeking a feeling that I keep asking you questions for that I'm never going to be satisfied with. Because whether I look nice or not, objectively, I don't really care what you think. I don't know that I don't care, but I'm waiting to feel right. And if, frankly, I can feel my muffin top popping out over my suit here, it's unlikely I'm ever going to feel that good. Despite you telling me, or someone that I love dearly telling me that I look very, very nice. So reassurance drives so much anxiety. And reassurance looks like a lot of things. It looks like, are kids able to get their grades online here? So reassurance just like hitting that refresh button, right? I'm anxious. Are they up yet, teacher? Are they up yet? Email, teacher, admin staff. I need this. I'm managing a feeling of distress, and the content of what I'm doing is probably irrelevant because those kids struggle with that reassurance seeking in lots of areas. Distraction, of course, works really, really well when we're anxious. We talked about that. And then compulsions, anything that we do to manage our distress. So the thing is when we do these things, the problem is we feel less yuck. We actually feel less bad. And so the brain really, really likes it. And this is how habits are formed. And so the next time I'm triggered and I feel uncomfortable, the brain says, quick, do that other thing you just did before so you don't have to feel that distress. So two things happen when you do that. You lose tolerance for feeling bad. You lose a lot of tolerance for feeling bad. And you lose your confidence in any ability to manage that trigger. I'm going to give some examples of that.
Can you say that again, please?
No. No, just kidding. Yeah. When you engage in this process, all of us do it with different things, but two things happen. You lose tolerance for your ability to manage any distress if you're always jumping to a way to cope. And then you lose confidence in your ability to face any new trigger that comes in. Is that the part? Okay. Yeah. And that's really counterintuitive than what we think about how to be helpful for people we love and we care for. Because what we want to do is just lay things out so people never get hurt. I'm practicing this. I have a 4-year-old. And so I'm learning a lot of how to tolerate my own distress to help her learn skills, how to be independent, how to regulate her own emotions. I think the most painful thing in the world is seeing her upset. And so I want to just pick her up and make her happy. So my wife's at work, that's what I do. My wife's sitting over here too. It's really, really tough. I give this example, right? Like, she started preschool last year, and we knew it was going to be challenging. She's very, very close to my wife, and we took her in, and she grabbed on, and she screamed. I just looked at my phone. No. She grabbed on, and she screamed, and the teacher walked up and said, "Goodbye, Mom and Dad." And I looked around and everybody's calm. And couple other kids were crying. So we're like managing that. We're kind of worried about judgment, something we've done, like everybody does. And we left. And it was awful. And everybody was okay with it. Everybody knew that in order for my daughter to build tolerance to being away from us and starting this whole brand new experience, she had to be miserable, scared, and upset temporarily to feel okay. But when our 13-year-olds do that or our 11-year-olds do that, we're not there. Because I think it's because developmentally we know that that's expected and that's okay. And I think part of it is that we're comforted by the fact that other parents kind of give you that eye in preschool. Yeah, that's tough, right? This is my third one. I haven't even seen him this year, right? In high school or middle school or elementary school when you're dropping off your kids and your kid's crying, there's a lot of shame from a parent point of view. There's a lot of embarrassment there. Because if your kid's struggling to be successful in school or struggling to have good friends or successful in their friendships or having conflict with you, as a parent, how do you not own that as something you've done? And it doesn't mean you've done anything. But I think that fuels some of the decisions just to say, come home. Right? And kids are savvy now because they can come home and just go, hey, online school, hook me up. I don't ever want to do that again. And we go, well, it's a lot of stress for them to go through this. I don't want to put them through stress. And so we make decisions based off of that. Excuse me. So what do kids do to avoid? What do we all do to avoid? Right? We drink, we smoke weed, we play video games, we exercise, we knit, we sleep, right? I say that so seriously because I don't want people to think that the things on that avoidance list or coping list are just bad things. It's not what we typically, it's anything that has that same function. Many parents, many mothers that I work with happen to exercise often. That falls right here, right? That functions the same way. If I go for an 8-mile jog every time I feel emotionally distressed, that's no difference from a functioning point of view than drinking, cutting, distraction. Now, it's more adaptive from a health perspective, but from an anxiety point of view, it functions the exact same way. Does that make sense? And so the goal is, I think, is to let people know, because you can't say to a teen, these things are bad for you, right? Because they'll just be like, then you're old and you don't know, right? But I really explain that, what's your relationship like with these things? So, and I say this to kids, I really enjoy drinking whiskey. And if I drink whiskey, hypothetically, 5 nights a week, and before presentations, but it was scheduled, it's less problematic than if I drink whiskey every time I just feel anxious. So if I exercise, people are like, what? But I exercise 5 days a week. That's really good. Totally. If you exercise every single day at 9 a.m., awesome. That's called self-care. That's called being healthy. But if you exercise only on days that you're very, very distressed, that's called coping. So it can be exercise, it can be knitting, it can be avoidance, it can be distraction. There's a lot of things that fall into this. Pornography, you name it. These things become a way not to feel. And you feel less bad. You never feel better, remember, you just feel less bad. But that loop gets stuck. So avoidance and distraction, and this is one reason that our phones are so helpful at helping us manage distress. Think of the last time most of you were in an elevator. The second that door closed, you went like this. You pretended to look at some things, you didn't have to look at somebody in the eye, right? Because it's just awkward, it's uncomfortable. It's really, really challenging. And that's without talking about everything that's on your phone and all the things that kind of pull your attention and ramp up your dopamine and get your brain all activated and stuff like that. So think about it. If the argument with your kid is, don't do these things because they're really bad for you, I really think that's where the conversation stops. But my conversation with kids is, man, you're pretty anxious. That's got to be miserable. I happen to think that what you're doing to manage it, smoking every day, and staying at home and just looking at YouTube, I really think that that's contributing to it. Well, weed is helpful for anxiety. And I go, no, it's not, but whatever. I'm not going to get into that with you because I don't care. I'm not your parent. I don't care if you smoke weed. I just want to help you not be anxious. Wouldn't you like to not be anxious? So let's stop doing some of the things that you've been doing just to see temporarily if that changes your levels of anxiety. And then they're kind of like, oh, I could probably try that. But if I come at it from this is bad, just like your parents came at it from this is bad and their parents came at it from this is bad, we don't really listen necessarily if they're already doing those behaviors. Accommodations. This is all you mothers there. That's you, right there. I say moms a lot just because I think it's a function of dads don't care, and no, I'm just kidding. No, I think it's a function of just availability when moms come in, but parents accommodate a lot to help kids manage their distress. And I've talked about that. I get it. I get it with so much empathy. I get it even more now that I'm a father. It's really hard to see your kids suffer. What I want you to think about is the accommodations fall exactly in the same path as that distraction and that avoidance. If the goal is for your kid, if the goal is for your kid to never feel bad, you have to accommodate every single day, all day. That's fine. It's your prerogative. But if the goal is for your child to build tolerance to distress, you have to accommodate less. And you have to accommodate their anxiety less. You can accommodate your kid all you want. I think that's awesome. So I'm not telling you not to do lovely, nice things for your kids that you love, but don't do it for their anxiety. Don't do it for their bully. Don't do it for that monster that pushes them around. I think you can get on the same page with your kid about that. And that's the conversation you have, like, hey, that bully's kind of punking you, and I don't really want to keep feeding it anymore. So what's a way that if I stop, I really think that every time you ask me, is everything going to be okay, that's just your anxiety asking me that. That's not you, Jake or Sarah or whoever that is. And that's the first step of treatment that we do with children, is we help them identify their anxiety as a separate entity, as that bully. Because now they can say, my anxiety is telling me I don't want to go to school. My anxiety is telling me my stomach hurts. My anxiety is telling me something bad's going to happen to my parents when they go to work. My anxiety is telling me I'm going to be a failure. My anxiety is telling me, and we can fight that. We can have a really nice conversation with that anxiety and challenge it. But if you don't say that, then it's just me. Something's wrong with me. I'm telling myself this stuff, and that's really confusing because it's my brain. So how do I fight my brain and a feeling that feels so real? That's how anxiety persists for so long, is that it feels so real. And you can't talk somebody out of it, like I've said before. So for parents, I think it's really helpful to take stock in the things that you do to accommodate. And that just looks like put a little sticky note in your home and add to it. Oh, that's an accommodation. I'll put that on there. That's an accommodation. You'll find pretty quickly that there's a lot of things that you do to accommodate their anxiety. Maybe. Maybe in the Camas district, that's not how it goes down. But everywhere else it is. And then you can ask yourself, you can't get rid of them all at once, right? That would be traumatic, right? You're on your own. Mom, we live 10 miles from school. I'm not accommodating this anymore, right? Right? Again, you're not accommodating their anxiety. So this looks like things like this. Mom, I forgot to tell you, I need glue for that project. Oh yeah, when's it due? Tomorrow. You know how many parents hop in their car at midnight to go to Fred Meyer for that stuff? Right? Totally. Right? That may or may not be anxiety. That's just poor planning, but it's the same process. You never learn to plan that properly again if your chauffeur goes and picks up your glue. Right? I've had parents knock on the door in the middle of therapy and say, I had to get him a smoothie. He hasn't eaten all day. I'm like, he's 16. Right? He can probably regulate his hunger. Okay. Right? Are you hungry? No. Are you hungry? No. I'll make you something. Right? Kids become entitled because everything is done for them. They really struggle to behave independently, not because they're just bratty kids, because they hadn't had any practice. So it's really helpful to start with those accommodations and then have conversations with your kids and just say, hey, I was thinking there's a lot of these things I do for your anxiety, I bring your iPad to school when you forget it often, a couple times a week. I make sure we get to school a half an hour early so you can kind of manage your anxiety before school starts, or I pick you up early, or I come for lunch. And have those, and say, I want to try something different, because what we found is we've been doing this for 3 years and you're no less anxious. So I approach everything like a hypothesis. I say, I don't know if this is going to help your anxiety, but we know that what you're doing is probably not, so let's give it a shot. And most people are on board with that. Again, whether they're 10 or they're 80. And then accommodations in school is a tricky thing because accommodations for anxiety, okay? So that's what we're talking about. How does a child overcome their distress, for example, of public speaking, when there's no longer an expectation they have to public speak? I've worked with lots of kids that request 504 plans for the public speaking, for their anxiety, extra time on tests, all these kind of things for feeling uncomfortable. And there's really no data to support, there's no objective way to measure whether these things are successful or not. And that becomes really challenging. Because most of the 504s that I've read say things like, you can leave class, you can get a drink of water. And most of the kids that have those aren't actually utilizing them. I actually think what is happening is it's more of just a validation form to say, we know you're struggling. We get it. We get it. And I think there's a way to be really helpful with that without giving an accommodation, because the truth is, if a kid, I mean, you have to have a medical person write a 504 or sign off on a 504, or at least give a diagnosis. And in my opinion, anxiety is treatable. It's really scary to say you don't have to do a presentation, or you get to avoid this, or you don't have to be here when the school bell rings because it makes you nervous. And these are all the things I've kind of seen. Instead of saying, yeah, that's super tough, but this class has 8 presentations in it. So the first one, you can just do after class. The second one, maybe you do it via video and we present it to 3 people in class. The fourth one, you do it with 4 people in class. Maybe the fifth one, you're in front of the class and now you're practicing, so your next class that has an expectation of speaking publicly, you actually have some competence and confidence in. Now, that sounds really easy and nice to just lay it out like that, but my point is we have to work towards building that muscle. And frankly, you know, teachers don't have a lot of time to do that, right? They happen to have other kids in their classes too. But, you know, there's like extensions on tests and all these kind of things, which a lot of kids are very skilled and competent academically. They're just nervous that they're not. There's been no demonstration or no record of them struggling academically, yet they have 504s to provide them extra time on exams and things like that, when they're just, because they're nervous about it. So it's, again, a little validation, and they probably don't use it. So there's ways that we can manage that, but the 504s are often driven through the parents who are trying to manage the accommodations of the kids, right? So that's kind of how it starts. I'm really scared, and you're, as a parent, you're like, I got to do something about this. Talk very briefly about phones. Any of your kids on their phone a lot? I am. I mean, I sympathize when people give people, I love my phone, right? I'm always like, who's texting or emailing me? I'll say this, there's lots of opinions about this. Phones are problematic for lots of reasons. They're not problematic just in the fact that they exist, and I don't think they're problematic that there's a lot of interest in them. Since children and teenagers have been invented, their goal is to socialize with other teenagers. Research does show that kids are actually interacting on social media with their friends. So they're not doing it with complete strangers. It's just an extension of the day. I used to get in a lot of trouble for being on the landline for 3 hours, right? Because my dad couldn't connect to AOL while I was plugged in, right? And I remember my dad saying to me, what could you possibly have to say for 3 hours on the phone? And I'm like, Dad, she touched my knee earlier today. It's worth it, right? But this is the same, we have this conversation every generation. Now, devices are unique and they're different, and they haven't been around that long, but it was the same thing with comic books and nickel arcades, and it was, you know, it was all these things were going to corrupt teenagers and children because their desire is to be engaged on their phone because they're getting a lot of social reward. So I think that's okay, but it's all about how much. Right? So if I wasn't doing my homework because I was on the landline for 3 hours, it's the problem that I'm not doing my homework, not that I was on the phone per se. So if expectations are being met, most parents don't care if expectations are being met, right? So if your kid's on the phone at the dinner table and that's an expectation in your home that they're not, that's not a phone issue. That's a parent-child relationship problem. The other piece is we're not actually that comfortable with letting kids hang out face-to-face anymore. I used to hang out at parks till it was dark, right? On the weekends, I used to just wander the mall for hours with a group of buddies, right? You're not allowed to do that anymore, and most of you guys wouldn't let your kids do it if they wanted to, depending on their age. So there's not a lot of options for them to actually interact with their friends outside of school. And communities are getting much, much bigger. I don't know what the geographic region is for Camas High School, let's say, but kids are probably driving in. It's not like they can just walk out of their neighborhood and see all their friends necessarily anymore. So phones have a place, but again, the amount of time and the expectations around them is more about how do you communicate about any expectations in your home. That's the conversation that I think people should have with their kids. My experience is parents want me to provide some very specific rules so they're not the bad guy. And I just say, hey, it's your house. I don't know how you want to manage that, right? So some things we do know. Kids that are anxious and depressed struggle to sleep. You really want to have a hard time sleeping? Have your phone in your bedroom, right? We know that that's not helpful. Because on average, between the hours of 11 and 2, girls are much more likely to be texting their friends and boys are much more likely to be on their phone playing a game. Generally, we know girls in a month send boys send 3,400 texts. And this is not social media, or this is text. Girls send 4,400 text messages. Remember when you had to pay per text? Right? That's your mortgage. Right? So this isn't going away, but having conversations about how people manage and utilize their phone is really, really important. So setting up plans about not having the phone in the bedroom. I struggle with that personally. That's just a good idea, and kids say, I use it as my alarm clock. And mom's like, I wake you up every day, right? So I have the conversation, but the same way you'd have the conversation if they're not meeting any other expectations. Their reality is very different than yours, and that doesn't mean there's wrong, it's just their reality. So if you hit them with, this is weird, you shouldn't be on the phone that much, then you're just going to look like our parents looked to us when they told us not to be on the phone that much or not to be hanging out so late. We just thought they don't get it. Sure enough, here you are with the same concerns saying, I don't get it. How can you keep texting? So that's the other piece, right? This stuff comes down to like, are you looking at people in the eye? You're saying please and thank you. The biggest problem that I have or one of the concerns when I'm working with kids is they don't look up. And that's not just because they have the phone. I think because parents do so much for the kids that I work with. So if I ask a child that I'm working with that's 15 how much a gallon of milk is, they have no idea. Or gas? No clue. Because they never have to do anything. Even if they're just shadowing their folks around. Right? They're not engaged with anything. They don't say when they walk into a store, hey, how are you? To the person that's working there, or, hey, go find that bread. No, I'm not doing that by myself, right? And so we're not allowing them to do these things. Or when you pull up to get gas, rolling down their window so they can say 20 on regular when they're 11, right? These are the interactions, these are the life skills that are really, really helpful for helping kids have confidence engaging socially. So there's 100 little things that one can do, right? We don't have landlines anymore. Some people do, but if that rings, everybody goes, your kid's not answering it, that's for sure, right? So doing things like having expectations for them, if they ask for something like, can we order pizza? You can say, yeah, but you're not ordering it online. You have to call. Right? Hey, call and see, we're going to go out to eat tonight. Call and see what time that restaurant's open. Mom, you can look it up on their website. Doesn't matter. Call and figure it out. Right? People pay me to do this with their kids. I will sit for an hour and call 100 restaurants so a kid can ask them questions. And they're anxious when the first 10 calls, and it gets less and less and less, and that's one session. And now they have some proficiency and competence and confidence in practicing these life skills. So anxiety in school doesn't always look like nervousness. It can look like inattention, right? Sometimes, like, if you think about what I've described today, excessive worry, obsessive thoughts, fear of judgment. Now, by the way, pay attention, right? That's really, really hard. Just imagine the days you've gone to work where you've had a lot on your brain. It's hard to focus. Disruptive behavior, it's much easier to be the kid that's a pain in the ass than the scared kid, right? And so we see disruptive behavioral problems with children, and 9 times out of 10, there's an anxiety or depression problem laying behind there. And then, of course, we have to figure out why somebody is not doing something. So if someone's not participating in class, that might have to do with the subject and their competence and their confidence, but it may just have to do with the anxiety, the social anxiety connected to it. So understanding that's really important. Not turning in homework. You know, perfectionistic people, they avoid all the time. And so sometimes, and they struggle to make decisions, because if it's not the right decision, they don't want to tolerate the feeling of not knowing. An extreme example of this is a population I work with are people that struggle with too much stuff, so hoarding individuals. Individuals that hoard are super perfectionistic. They don't discard anything because they can't make a decision. It doesn't feel right. Do I throw this away or do I not? Raise your hand if you have a few of these problems tonight. No, I'm just kidding. So lastly, I mentioned before that one of the biggest concerns that kids ask for is, I want my parents to listen to me, and parents ask the same thing. To me, this comes down to empathy. You guys pay millions of dollars a year for people to go to therapy to be validated, right? That's the first step, right? That your problems matter, that your reality is intact, that it matters to you. You can't get anywhere with your kids if you don't do this. This is how it usually looks. Kid gets home from school. Hey, how was school? Sucked. Why? Well, Mr. Smith gave me an F. Sarah's such a bitch, I'm never going back to that class again. And parents usually say, now, what we've talked about swearing, okay? Mr. Smith didn't give you an F, you earned an F, you didn't turn in that paper. And I told you not to hang out with Sarah. She's not a really good influence. And kids go, and then tomorrow when you say, how was school? They say, fine, right? We don't want our problems solved, whether you're 15 or whether you're 35. Initially, we just want to be heard. And so it's okay if swearing's not okay in your home. Totally fine. That's probably not the best time to have a conversation about that. As someone, you've asked them a question, so you either want to know information or you want to manage your own distress by solving all their problems. And usually it looks just like that. Well, have you done this? Well, have you thought about that? Well, are you going to study? Empathy and validation is about just listening. So a really good skill, this is a tool in the toolbox. Go like this. Really practice not saying anything and fight that urge when you're connecting with your kids. And it sounds really, really goofy, but you know, they teach you to be a therapist, 2 lines. Tell me, say more about that and how does that make you feel, right? But truly, empathy, if you don't know what that is, you're a sociopath. And you can really practice that just by repeating back what people say to you. I had an awful day. It sucked. It was awful. Yeah, it was. You're not going to believe I sat in traffic. I had to do this presentation. I'm so stressed out. It's exhausting. Yeah, it sounds like you worked really hard. I did. And then, you know, the difficulty is, and people just keep talking. And within like a session, parents are like, how did you get him to open up? And I'm like, I listened. I didn't do anything. I just listened and allowed space for that to happen. We all want to be validated. We don't want our problems to be solved. So there's some tips here on how you do that. Think about where you're going to do that. Don't ask people how they are if you're distracted by your own phone or your other children or something else going on, right? I have a friend, he's my best friend in the world, and he calls me all the time, and within like 4 minutes he has to go. And it's the most frustrating thing in the world, right? What's up, man? How's things? Oh, pretty cool. I got it. Hey, man, I'll have to call you back. Right? And everybody knows that conversation when you start talking to someone and they're like, and you're not being heard. So that teaches us that you don't actually want the information, so next time I'm not going to give you the information. The other thing I'll say is, kids tell me a lot of things. Some of them are very, very scary, particularly being a parent of a girl, right? Terrifies me. And my job is to not tell their parents this information, because I promised them that I wouldn't. But my job is to help them figure out the best way to communicate with their parents. So whether that's about sex or drugs, or sometimes scarier stuff. And the thing that many teens say to me is, oh, my parents couldn't handle this. Because history has told them that the reactivity to other things has taught them not to give you the good stuff. Because of that initial, what? Well, have you? You should. So really practicing that for a long time. And if you've got a child that doesn't really want to chat with you, ever, that happens. The best way to do it is this. Hey man, how was school? Fine. Okay. Anything you want to talk about? No. Okay. Well, I'll tell you what, I'll be over here doing that thing. Let me know. I'm always available if you want to chat. That's all you've got. But one day they will come and say something. And that's when you can say, I'm here. Right? And don't overthink it. Because what happens is, if you have a child that doesn't speak to you very often and they come to you, you're so excited that they're about to tell you something, you want to have the best advice ready. And that's one of the biggest mistakes you make as a brand new therapist. I used to think I had to give advice to people. So people would tell me stuff and I wouldn't listen because I'm thinking of what to tell them. We're always waiting for our turn to talk. We're always rehearsing what we're going to say the next. So when we're not listening, we're in rehearsal mode. So people say something and then it triggers something in our brain that we have an anecdote to or a little story or an opinion, and we stop listening to the rest of it because we're rehearsing how we're going to say what we're about to say. And then we wait for the polite pause and we go, you know, that actually reminded me of a... And people don't feel connected. So summarize what you've heard, express appreciation. There's a video here that I can't show you because I don't have sound, but look it up. It's Brene Brown, Empathy versus Sympathy, and it is about how to connect with people. It's a few minutes. It's awesome.
Can you say that one more time?
Yes, it's Brene Brown, Empathy it's going to play. Brene Brown, Empathy versus Sympathy. If you just Google it or YouTube it, it'll pop right up.
What was that first name again?
Brene,
Do you know how that's spelled?
Brene. If you have not heard of Brene Brown, you should eat her up on TED Talks, on YouTube. She's got some awesome books. She talks a lot about shame and guilt. She's a researcher, social worker that's a researcher. It's great. So some things I want you to take away from this, and then we're going to ask some questions. Or I'm not going to ask any questions. You are. I'm going to answer some. Being anxious doesn't mean that there's necessarily something wrong. So if your kid's life is stressful or your life is stressful appropriately, that might be okay. Sometimes you do just have to ride that wave. And coping skills have a place. It's important to cope, to ride the wave, if it's temporary. And just to get by, it's okay to cope. Once you start a plan for overcoming the anxiety, that's when we want you to stop coping and change your relationship with fear. Don't feed the bully. Don't help your kids feed the bully. Don't feed the bully. Very important. My poor sister. And I think this is so important. If you take one thing away, it's probably two things. That yuck diagram, super important. But if you sum up what I'm talking about here, it's helping your kids make decisions based on preference and not fear. So if I want to do something, and only us individually know this experience. So if I want to do something and I get that little flutter of fear, anxiety, hotness, whatever it is, and I make another decision, and I can justify it all day long. Nobody knows I made an avoidant decision. I do. That adds up, and more avoidant decisions make more avoidant decisions, and that ruins my confidence. An example of that is if I'm nervous about being up here, I could leave this mic up here, and that protects me behind the podium. And I can just tell myself, well, you know, it was on a stand there, I didn't want to hold it. But I really know I did that so I didn't walk around and move, because I was nervous. If we know we're making decisions based on preference, great, awesome. You know, I want to take the stairs because my legs hurt, cool. But if you're taking the stairs because you're scared of the elevator and you pretend it's about your legs, you know that. So, we'll take some questions. I will tell you I've got 2 things. So I do have a YouTube channel, which I've never really promoted, and I've been told I should start telling people about it because besides my mom, only one other person has looked at it. So I have a YouTube channel, and I have a similar presentation like this on there. It's an hour long that I gave to Jesuit high school to all their sophomores. And then a lot of the videos are just kind of little clips, 2 or 3 minute little tidbits. So that's just Fighting Fear with Kevin Ashworth. And then if you go to our website, northwestanxiety.com, I have 3 parent workshops that are scheduled for this year. So the next one's April 14th. It's a 5-hour workshop on a Saturday where this is the theme in just more depth. So you can really then talk about your kid. Like, what do I do with my kid? Here's my kid. This is how we do this. This is what's not working. Help. And so it's 5 hours. It's actually a lot of fun, and it's pretty intense, but you get a lot out of it. So questions? Yes?
You said at the beginning, when you made reference to that kids have more anxiety these days than in the past.
Yeah.
What were your thoughts of why that is? Is it because we're more accommodating with parents, or?
Yeah, I do think it has a lot to do with that we are more accommodating. I think there's lots of reasons, and depending on the discipline of the person that you ask, whether they're a brain scientist or a medical scientist, you know. But I do think it is about tolerance. And we changed a lot of things with the baby boomers. We invented something called parenting. Prior to that, it was called child rearing. Like there wasn't, you know, we don't wives our wife, right? But we've come up with this term, right, where it became really, really important that our kids are great representations of us. And, you know, getting that bumper sticker of Harvard or Stanford or whatever is really important. And that changed perspective. So people want to say, you know, kids these days, it's kind of the generation prior to that, sorry, right? Because they're the ones doing the parenting. So I think because of that need to feel good, we want to protect. That's one reason. My other theory is just awareness and knowledge, right? We love to talk about that. You know, kids have changed dramatically these days. Anywhere from like they're more anxious or less respectful. They don't, back in my day, you know, kids just did what I told them to do. Yeah, well, why is there 50 and 60-year-olds in prison, right? They haven't just got there in the last 5 years. They had lots of problems back in the day too, right? And they likely had lots of problems that had to do with anxiety and depression. We just didn't call it that. We called it oppositional defiance, or we called it pain in the butt. There's also lots of 50 and 60-year-olds that struggle with opioid addiction and lots of kinds of addiction. Those people have lived a life of trying to avoid feeling anxious and depressed as well. So I do think part of it is we understand it a little bit better. We have more things like this set up, interventions, knowledge. But you know, the type of therapy that I do has been around for so long. I mean, it's one of the behavior therapy is one of the oldest type of therapies. But I think those things definitely contribute to it. And you know, devices do have an impact, right? Like one thing that social media is not great for is if you want to feel shame, compare yourself to somebody else, right? So Brené Brown says comparison is the thief of happiness. And so it doesn't matter how good I've got it. All I have to do is see my neighbor who's got it a little bit more, and I immediately feel terrible about the stuff I've got. So now, imagine that when I open my Instagram and my friend Susie has contoured her face, put on a filter, you know, photoshopped her boobs, and I feel fat and ugly, and she looks amazing. But I get that 100 times a day if I open my phone. Total comparison over and over and over. And that's really hard to get away from. That's one of the downsides of having access to that. The other piece is this. I don't know how this happens, but I get the New York Times and something else just buzzed to my phone all the time. So I'm constantly inundated with terrible things happening. Right? So if I pay attention to those and read those, I'm on edge much more than I ever used to be. Growing up, we had 3 channels, and if something terrible happened in China, I didn't know about it ever, right? But now, something so obscure I can know about here that I would never have known. So I think that's my opinion. That's not supported empirically, but I think working with kids, that's some of the experiences that I've had. Yes?
I have a 9-year-old that has trouble sleeping at night ever since we've moved into this, I'll say new house, but we've been in our new house for 3 years.
Okay.
And I took some notes here. You said we cannot change our feelings directly. You can control your behavior, you just don't feel like it. So for my 9-year-old who is fearful at night because he says he's scared.
Yeah.
And we talk about talking to God and praying because we're believers, and being fearful isn't of God, and we are in our safe place. This is our house. There's nothing to be fearful of. How do I get him over that hump?
Yeah, that's a really good question. So that's a big question that without knowing lots of details is hard to answer, but I'll try my best. What you're doing is giving him lots of reassurance that everything's okay. That makes great sense. The question is it helpful? So if you've been giving him reassurance for 3 years that everything's okay, that if he believes enough or prays enough or has faith or you just love him so much that things will be okay, we don't maybe quite yet understand what's so scary, right? And so sometimes we have to just practice doing things differently in order to see, right? So does he have a routine around bedtime? That's a question that I'd want to know. How does he sleep? What kind of movies does he watch? What kind of thoughts is he having? There's 100 reasons, right, that a kid might be scared to go to bed. So the most common is like, I have awful dreams and I don't want to have those dreams, right? For some kids, it's I don't want to sit by myself for that perceived amount of time that it's going to take me to fall asleep. That's why we're comforted when someone lays next to us until we fall asleep. And that's why many kids end up in their parents' bed, because that's the piece that's really scary. So if that's really scary, I want to know, what are you thinking about then during that time, right? What thoughts come up? And a 9-year-old can absolutely tell you that, right? Well, I don't know. I worry about, Mom, you dying, right? And if the answer to that is, honey, I'm not. I'm totally safe. He'll go, oh, can you fall asleep next to me then? Right? It doesn't actually help him have any confidence in his ability to manage that uncertainty. So addressing that understanding it first is really important before an intervention is given. Because if we give an intervention and we don't understand why, we really are just throwing something out there. And then if it's not successful over time, we rob that kid of his hope of getting better. Because kids that go to therapy frequently that don't get better start to really think they're really screwed up because they haven't gotten better. So to me, this would probably be a very behavioral change. So he feels scared and he's 9, so that makes total sense that he doesn't want to go to bed. And I would empathize with him all day about that, right? How scary is that? And I would want to know, so if your mom lays next to you, is that scary? No. Okay, so it's not your room, not my room. Okay. If your brother lays next to you, totally fine. Okay. If we turn on the light, nope, too scary. Okay, so what you're saying is I have to sit next to you. Yes, okay. So likely, we don't have to understand the why, maybe, but an association has been developed, possibly, between I'm safe when mom's here. So, great. So for the next week, I'm going to lay next to you until you fall asleep, and then I'm going to sit next to you. Then I'm going to sit in the chair next to your bed, then I'm going to sit by your door, and then I'm going to be out the door. And then the door's going to be open, and eventually the door's going to be... it's a trial and error.
That's not accommodating his fear, though?
It is with a goal, right? It is with a goal. You're accommodating his fear with the purpose, like, hey, the goal here is you're going to sleep by yourself. But we know I can't just leave and have you fall asleep because you haven't done it in 3 years. So we are going to create a system or a plan to help to wean you essentially off of this attachment or this association that you have to be with me to fall asleep. Yeah.
What is your professional opinion on medication for anxiety? More specific, schools pushing medication, diagnostic treatments for children with behavioral issues, what we call designer label of ADD, ADHD, which technically could be trauma or anxiety. What do you do when you have a child who is extremely medicated and now is in your office?
Yeah, so there's complex cases, there's lots of things. So if we're talking about anxiety specifically, an anxiety disorder, we treat it very, very behaviorally, unless, we really don't recommend medicine unless a good trial of behavior therapy has been done, unless a kid has OCD or sometimes generalized anxiety disorder. But even then, an antidepressant medicine, which is the go-to medicine, an SSRI, something like Prozac or Zoloft or something like that, Celexa, Paxil, they're effective 50% of the time. Like, it's a coin flip, right? And some kids respond really, really well. And I would feel really bad if that kid was never had that medicine attempted, a trial on him, and he could have been, his suffering could have been ameliorated. But one of the problems is medicine is not often prescribed at the right dose. And so, prescribing with kids, and I'm not a prescriber, this is just my experience, but prescribing with kids, it's often just at the starting dose because, we don't want to go too far. But with OCD specifically, you have to be at a much higher dose for it to have any kind of impact. So, again, with anxiety, that's what I would say. Because a medicine can really work like a safety behavior too on that list, right? We can do all this work all day long, and then the kid's like, I started on Zoloft. I'm getting so much better. And I'm like, you're getting better because you've been in therapy for 6 months working your butt off, right? But we start to believe it's because of the medicine. With other things, kids absolutely, the empirical research for ADHD, suggests that medicine is very, very helpful. And if you've ever had a kid that has ADHD and then started a stimulant, it's very, very helpful. In fact, it's probably one of the only diagnostic ways to know if a kid has ADHD, because if they don't, and you give them a stimulant, they're activated. And if they have ADHD and you give them a stimulant, it has a paradoxical effect, and they're focused and calm. But behavioral things, I think that it just really depends. It really depends. It depends what you're treating. So I think understanding exactly why your medication is suggested. But you have to understand, if you ask a psychiatrist, that's their role, is to prescribe medicine. And not all that's all they do. But then the most likely way that you get help is your primary care physician, which they're going to try and be helpful in some way, and that's going to be probably to prescribe medicine. Anyone else? Yeah?
Our kids that nothing is their fault. So they are late.
They're angels.
They're late to school because you didn't get them up on time. They didn't do their homework because you didn't remind them to do their homework. Even if you're not a parent like that.
Mm-hmm.
What do you do with kids to realize that they are in charge of what happened?
Well, I mean, the question that I would have is, what are you doing for them, right? So if you own it, the problem is, for the difficulty with lots of parents is you end up caring more about stuff than they do, right? So if they don't care about going to school on time, but it really matters to you that they're punctual, right? Then it all falls on you, because now you have to get them up from their eyes. Because if you don't get them up, they don't really care. Parents often bail kids out of consequences. So if a kid's late to school, they should be marked tardy or truant or whatever it is. If they don't do their homework, there should be repercussions for that. Many parents want to save kids from that experience, and so they work really hard to make sure this stuff is done. This case, if that's not happening and they're just blaming you, I'm not sure. I'd have to totally know more, right? Why are they just saying, hey, I'm late, and you're at work, and I'm blaming it on you?
That's why I'm baffled, because I'm very firm in the self-sufficient. If you didn't make your lunch, I'm sorry, you're going to be hungry. Maybe tomorrow you'll make it, but
So they have an expectation that you're supposed to do that for them. That you're supposed to do that for them. Their expectation is that you're supposed to do all these things for them.
They know I'm not going to do it, but yet it's still my fault that it didn't happen.
How old are they?
11.
Oh, yeah. I mean, part of that is just taking ownership and responsibility that an 11-year-old might not be able to do. That might just be frustration, right? Like, I don't want to own up that I've goofed up, right? By the way, I forgot to make lunch last week, so I haven't eaten for 7 days. I would just, some of it, though, is sometimes it's about having less of a conversation. And so when kids say, this is your fault, I'm late. Okay. Because if you engage in a conversation about it, now, John, let's talk. Now, you're responsible for setting the alarm. We've had that conversation, right? It creates this whole dynamic around it. Instead of just saying, okay, that's weird that you're blaming me, but I don't know what to tell you. Yeah. Any other questions? Great. Yes.
Interesting what you said about 504s and accommodations.
Yeah.
And being a school counselor, and kids and parents come in and said, my kid needs a 504 because
Yeah.
they've got anxiety and
Yeah.
we want this, and this. And what you're saying, it sounds like that's not necessarily a great thing for kids.
It depends. So I often say, how do you think that would be helpful for them? So how would this 504 help their anxiety? And is it possible that this 504 might maintain their anxiety? There's a legal thing there. You can't just say no, right? So it's
You don't need a diagnosis.
for a 504, right? So I think just saying, how do you think this is helpful? Well, we really just want Sarah's English teacher to know. Okay, why don't we send an email and set up a meeting and have a conversation? Oh, okay, we could do that. Great. And I really think once parents feel validated that people are just like, hey, I know Sarah's struggling with some stuff, I'll help manage that, that process gets kind of avoided. Yeah. Great. Thanks, guys. Appreciate it. Oh.
All right, really quick before you leave, I just want to make you aware of a couple of other awesome speakers that we're bringing in this wellness series. So the next one will be Monday, March 26th, and the speaker will be talking about electronics and the impact on the emotional brain. I've seen that one. It's really compelling. And then we're also having one in April. Howard Hayden is coming to talk about competitiveness and high expectations and how to build resilience and independence in our kids. So please be on the lookout for those things. So we really appreciate you coming. Thank you so much.